child hospital, and we are, as you all know, Rainbow Children's Medicare Limited is a public limited company. We are listed in the stock exchange. We are a JCI accredited hospital. We focus mainly on high quality clinical care for mother and child. This is going to be our flagship hospital at Sarjapura Road. We are expected to start our operations this month, by the end of this month. Happy to take any questions.
Spoke hospital you are talking about.
Yeah, we work on a hub and spoke model, wherein we get a larger coverage of a city or a state in a hub and spoke model. Our hub in Bangalore is the hospital at Marthahalli, which is, yes, and we have spoke hospitals in Hebbar, in Banarkata Road, and now in Sarjapur.
All the four hospitals
All the four, sorry?
no, spoke hospital is all the four you are giving the spoke hospital like.
No, the hub hospital is the Marthahalli hospital, the others are the spoke hospitals. So we work on a network effect so that we have a greater coverage of the city.
Sir, any development in the hospital, in this hospital? Any development in this? New development? Upgraded.
Yes, service.
What we see in this area, especially the Sarjapura and Bengaluru area, so we need a comprehensive pediatric care. This hospital will offer 24/7 children's emergency care and critical care. So that's one of the main focus. If you look around this place, and we do not have a serious critical care children's hospital and 24/7 emergency care. So along with that, so our high-end obstetric care, which is more towards a kind of high-risk pregnancy care, also we need to provide it. So the combination of obstetrics and pediatric hospital, we do at a larger format. Generally, Rainbow Children's Hospital is across the country. We are India's largest children's hospital group. We have close to 1,900 beds across the country. And in the largest being in Hyderabad, we are almost 900 beds in Hyderabad with 8 hospitals, like a large hub and the spokes, about 7 spokes. So the next largest is in Bangalore, is now where the 4th hospital being inaugurated. What we see is like, when we could do Hyderabad about that many beds, I would see that Bangalore requires that many beds as we move forward in the next 4-5 years time. It's very important that creating the number of beds is not important. Executing the model is the most important. One is that, what is the difficulty in executing model? What you need to have a 24/7 coverage is the most important. And also Rainbow has a very peculiar, very different healthcare model compared to many hospitals. Most of our doctors are full-time doctors. So they only work for Rainbow. The majority of the doctors don't do clinics at home or some other places. So therefore they are available for the nighttime coverage also. So there is a consultant-led service, not only the daytime, and also its nighttime is also there. This is something very, very special. The full-time doctor engagement model is very, very important. That's what actually children's healthcare demands, which is why it's not that easy to replicate number of beds in children's hospital like other adult hospitals. So most of the adult hospitals sleep by evening 7-8 o'clock, all the surgeries are over. Then, the only ER and other areas works. In the children's hospitals, most of the times when you see, recollect yourself also, children start becoming sicker towards the middle of the night, early in the morning. So they rush to hospitals. Therefore, we require care for children 24/7. So that's why the children's hospitals are very different. Across the world, children's hospital healthcare works in a similar model. Whether it is in Europe or America or across the world, children's hospitals work on 3 fundamentals. One is that they are very multidisciplinary, because it is not like this is my specialty, I only practice this. And most of the times children comes through the emergency department, come as a very sick child. What you see children is like a very, very critically sick child. It will not tell you what department, which department. Therefore, you have to address the sick child and diagnose the condition, maybe infection. It may be cardiac failure, it may be renal failure, it may be liver failure. So therefore, the people have to work in the teams. And even if they are in intensive care also, because full-time doctors for children's health care. Third is that children-only environment. Because the doctors are specific for children and they are specialized in children's health care and multi-specialty. For example, I am a children's gastroenterologist and liver disease specialist. I also was trained in the liver transplantation in London. So when I came back, we started a liver transplant program in Hyderabad. Initially, I started with an adult hospital called Global Hospital, only transplant program, working in Chicago. Then eventually, so that it just tells you that the children's health care is very different from adult health care. So we require more and more children's hospitals in this country as well. And to do in Bengaluru and Chennai city. So we are planning to do in National Capital Region also the similar kind. Particular listed company, we have already made it very clear. So now Rainbow Children's Hospital, we have about 18, close to 1900 beds. With expansion, which is kind of next month we are opening a hospital in Ananagar, Chennai, and also another hospital in Hyderabad. With that will be about 1900 beds. So we have 1000 beds pipeline in a year time, in 4 years time. So most of the beds are going to be added in the National Capital Region. We are doing 2 hospitals in Gurgaon. We would like to do one flagship center in Gurgaon as a kind of a national referral center. And we plan to add more in the southern India. How I see is that now we have a southern region. So we are in Hyderabad, we are in Bangalore, we are in Chennai. So we are also in Visakhapatnam, we are also in Vijayawada. So we are now planning to do one in Coimbatore. As we move forward, we want to do one in Kurnool and one in Nellore. So that between Hyderabad, Bangalore and Chennai, almost every 200-250 kilometers there is a Rainbow Children's Hospital. We do one in Salem. So that will allow us to kind of go and pick up any emergency, any of these places. It will cut short our kind of time to kind of transport these children between these 3 cities. This is one of the kind of my major agenda for future is that connect the south. I am Dr. Ramesh Kancharla, Chairman and Managing Director of Rainbow Children's Hospital Group. So we are proud to announce opening of our 4th unit in Sarjapur, Bengaluru. So this hospital is about 100 beds, and what we plan to do is that provide a high quality children's health care with the 24/7 emergency and critical care services, and also the high risk obstetrics and also the advanced maternal care in this hospital. So this is the area which is very densely populated with young parents and working class from the IT industry. So this kind of facility is highly required. So we realized that, and then we have done, this is the 4th unit of our Rainbow Group. So as a Rainbow Group, we are the largest children's hospital group in India, and we are the only publicly listed children's hospital in the English-speaking world. So that means that there is only one children's hospital which is listed in the publicly listed in the stock exchange. This is only Rainbow Children's Hospital across the world. So that is something very important, because this will allow us to kind of replicate this model, do more children's hospitals not only in southern India and also across the country, especially in places like National Capital Region. Still they are very short of children's hospitals. So in the south we have 16 children's hospitals, 8 in Hyderabad, 4 in Bangalore and 3 in Chennai, and also 2 in Andhra Pradesh. So we're going to increase some more hospitals in south, as well as to build up more hospitals in National Capital Region.